Hi, I'm Dr. Evelyn Reed, a cardiologist, and for the next few minutes, I want to talk to you about this incredibly common, yet widely misunderstood condition. We're going to demystify high blood pressure or hypertension. We'll break down what it is, why it's so dangerous, and most importantly, I'm going to lay out a clear, evidence-based plan for how you can manage it and take back control of your health. This isn't a story of fear, it's a story of empowerment. So, let's get started. To get our heads around hypertension, let's use a simple analogy. Think of your circulatory system as a garden hose. Your heart is the pump, and your arteries are the hose, carrying life-giving oxygen-rich blood to every part of your body. Blood pressure is just the measurement of the force of that blood pushing against the walls of the hose as your heart pumps. Now, this pressure isn't supposed to be static. It naturally goes up when you're exercising or stressed, and it comes down when you're resting. That's totally normal. High blood pressure or hypertension is what happens when the force of that blood is consistently too high even when you're relaxed. It's like cranking the spigot on that garden hose all the way up and just leaving it there day in, day out. Over time, that constant pressure will strain, damage, and wear out the hose. The same thing happens inside your body, but the stakes are much, much higher. When a doctor or nurse takes your blood pressure, they give you two numbers, like 120/80. Let's quickly break that down. The bottom number is your diastolic pressure. That's the pressure in your arteries when your heart rests between beats. It's the lowest pressure your arteries experience. Both numbers matter a lot. Based on the latest guidelines from organizations like the American Heart Association, here's how we generally classify it, though. The exact numbers can vary a bit by region. Normal, anything below 120/80 mmHg. If this is you, fantastic. The goal is to keep up the healthy habits that got you there. Hypertension stage 1. This is a consistent reading of 130 to 139 on top, or 80 to 89 on the bottom. At this point, your doctor will push for immediate lifestyle changes and might consider medication, depending on your other health risks. Hypertension stage 2. This means your numbers are consistently 140/90 or higher. At this stage, your doctor will likely recommend both major lifestyle changes and medication. Now, here's the scariest part. For the vast majority of people in the elevated stage 1 and even stage 2 ranges, there are usually zero symptoms, no headaches, no dizziness, nothing. You feel completely normal. This is the silent killer. The damage is happening quietly over years without you even noticing. The only way to know is to get your blood pressure checked regularly. It's also worth knowing there are two main types of hypertension. About 90 to 95% of the time, it's primary hypertension. This just means there's no single clear cause. It's more of a perfect storm that develops over years from a mix of genetics, aging, and lifestyle choices. The other 5 to 10% of cases are secondary hypertension, which is high blood pressure caused by something else, like kidney disease, thyroid problems, certain tumors, or even some common medications like decongestants and pain relievers. In these cases, treating the root cause can often fix the blood pressure problem. But for most people, the journey starts with discovering that their number is too high, often for reasons they can and can't control. And that brings us to the really critical question. Why is this silent number such a massive threat to your health? So, your pressure's a bit high. You feel fine. What's the big deal? I hear this all the time, and the answer is serious. Think of uncontrolled hypertension as a slow-motion demolition crew working 24/7 on the most important structures in your body. The constant pounding force of that high-pressure blood flow damages the delicate inner lining of your arteries, paving the way for disaster. Let's walk through what's happening. First, your heart. Your heart is a muscle. If you force any muscle to work harder, it gets bigger. Pumping blood against high pressure is like making your heart lift a heavy weight with every single beat. To cope, the heart muscle thickens and gets stiff. A thick, stiff heart doesn't pump well. It can lead to congestive heart failure where the heart just can't keep up with the body's demands. And all that damage to your arteries makes them ripe for atherosclerosis. The buildup of fatty plaque. If a plaque bursts in an artery feeding the heart, a clot can form and block blood flow. That's a heart attack. Next, your brain. Your brain needs a constant, steady supply of blood to work. High blood pressure is the single biggest risk factor for stroke. It can cause an ischemic stroke, where a clot blocks a blood vessel leading to the brain, starving brain cells of oxygen. Or, it can cause a hemorrhagic stroke, where the constant pressure weakens an artery until it bursts and bleeds into the brain. Long-term high blood pressure is also a major contributor to vascular dementia, a type of cognitive decline caused by poor blood flow. Then, your kidneys. Your kidneys are your body's master filtration system, full of millions of tiny, fragile blood vessels. They are incredibly sensitive to pressure. High-pressure scars, these delicate filters, and over time they start to fail. This is chronic kidney disease. Hypertension is one of the top causes of kidney failure worldwide, which requires dialysis or a transplant to survive. Finally, hypertension batters the arteries themselves all over your body, making them hard, stiff, and less flexible. This hardening of the arteries creates a vicious cycle, forcing the heart to work even harder. It can also create weak spots that bulge out, forming an aneurysm which can rupture and cause life-threatening internal bleeding. The stakes really couldn't be higher. It's a domino effect of potential failures in your body's most vital systems. But here's the most important thing to hear. This damage is not inevitable. It is largely preventable, and the first step is understanding who's most at risk. Figuring out your personal risk is a key step toward protecting yourself. The risk factors fall into two buckets, the ones you can't change and the ones you absolutely can. Let's start with the non-modifiable risks. The hand you were dealt. First up is age. It's a simple fact. As we get older, our risk goes up. Blood vessels naturally get a bit stiffer over time, which can lead to higher pressure. This is why getting checked regularly is so important, especially after 40. Second is family history. If your parents or siblings have high blood pressure, your odds of getting it are much higher. You might have inherited genes that make you more sensitive to things like salt. Third is ethnicity. Some groups are at higher risk. For example, people of Black, African, or Caribbean descent are more likely to get high blood pressure, often earlier in life and more severely. This is a complex issue, likely stemming from a mix of genetic and environmental factors. Finally, certain other health conditions like diabetes and chronic kidney disease dramatically increase your risk. It's a destructive feedback loop. High blood pressure makes these conditions worse, and they, in turn, make blood pressure harder to control. Now, hearing about risks you can't change might feel a little defeating, but I want you to flip that thought on its head. Knowing you have these risks doesn't seal your fate. This means you have every reason to be proactive and take aggressive control over the second category of risks, the ones that are entirely in your hands. These are the modifiable risk factors, and this is where your action plan really begins. The biggest one by far is an unhealthy diet, especially one that's high in sodium. We'll get into the details soon, but too much salt makes your body hold on to water, increasing blood volume and driving up pressure. Next is physical inactivity. Living a sedentary life means your heart has to work harder with every beat, which increases the force on your arteries. Directly related to that is being overweight or obese. When you carry extra weight, your heart has to pump blood to more tissue, increasing the workload on the whole system. The good news: losing even a small amount of weight can make a huge difference. Looking at this list of modifiable risks should feel empowering. These aren't just risk factors, they're your roadmap to a healthier life. Each one is a lever you can pull. And that brings us to the most important part of this whole discussion: your complete game plan. If you remember one thing from this video, let it be this. Lifestyle changes are the absolute foundation of managing hypertension. They are the first thing we recommend for every single person with elevated or high blood pressure. For many people, these changes alone are enough. For those who need medication, these habits will make it work better, often at a lower dose. This isn't optional. This is ground zero for taking control. So, let's build this new foundation, piece by piece. First is your diet. What you eat has a direct, powerful impact on your blood pressure. The most proven eating plan for this is the DASH diet, Dietary Approaches to Stop Hypertension. It's been named a top diet for heart health for years, and for good reason. It flat out works. DASH isn't some crazy restrictive fad. It's a balanced way of eating that focuses on real, whole foods. The main ideas are simple. Load up on fruits and vegetables. They're packed with fiber, vitamins, and minerals like potassium that help lower blood pressure. Go for whole grains, like brown rice, oats, and whole wheat bread instead of the white refined stuff. Choose low-fat or fat-free dairy. Focus on lean proteins like fish, chicken, beans, and nuts. Use healthy fats from things like avocados, nuts, and olive oil. It's just as much about what you limit. The DASH plan is naturally low in junk food, red meat, sweets, and sugary drinks. It's a shift from processed food to real food. Now for the single most powerful dietary tweak you can make, the sodium showdown. Our modern diet is drowning in sodium, and it's not from the salt shaker. It's hidden in processed foods, canned soups, frozen meals, deli meats, bread, and restaurant food. When you eat too much sodium, your body holds on to extra water to dilute it. That extra water increases blood volume. It's like forcing more water through that garden hose. The pressure has to go up. The goal for most adults is less than 2,300 milligrams of sodium a day. But for people with high blood pressure, the ideal target is even lower, 1,500 milligrams a day. For perspective, a single teaspoon of table salt has 2,300 milligrams. Cutting back can lower your blood pressure as much as a starting medication. Sometimes in just a week, you have to become a labeled detective. Read the nutrition facts. Cook at home where you're in control, and flavor your food with herbs, spices, garlic, and citrus instead of salt. The other side of the sodium coin is the power of potassium. While sodium raises blood pressure, potassium helps lower it by helping your body flush out sodium and easing tension in your blood vessel walls. Great sources include bananas, spinach, sweet potatoes, beans, and yogurt. The DASH diet is naturally packed with potassium, which is a key reason it's so effective. Next up, get moving. Regular physical activity is a miracle worker for your heart. It strengthens it, so it can pump more blood with less effort. Less effort means less force on your arteries. The goal is at least 150 minutes of moderate intensity aerobic exercise per week. That's just 30 minutes, 5 days a week. Think brisk walking, cycling, swimming, anything that gets your heart rate up, but still allows you to hold a conversation. If you can, add in strength training a couple of days a week, too. Consistent exercise can lower your top blood pressure number by as much as 11 points. This ties right into weight management. If you're overweight, losing even 10 pounds can have a massive impact. Lowering your blood pressure and making any medications you take more effective. We also have to talk about limiting alcohol and quitting smoking. If you drink, keep it moderate. If you smoke, quitting is the single best thing you can possibly do for your heart, period. The benefits start almost immediately. Finally, stress reduction. Chronic stress keeps your body in a constant fight or flight mode, which wears on your heart. You have to find healthy ways to cope. That could be meditation, deep breathing, yoga, or just spending time on a hobby you love, and prioritize sleep aim for 7 to 9 hours a night. A lack of good sleep is directly linked to higher blood pressure. This lifestyle plan is your primary arsenal. It's powerful, it's proven, and it's in your hands. But sometimes, even with the best efforts, it's not quite enough. And that's when we bring in our next tool. For many people, especially those with stage 2 hypertension or other high-risk conditions, medication isn't a replacement for lifestyle changes, it's a critical partner. And I want to be crystal clear, needing medication is not a failure. It's a sign that you are taking your health seriously. These drugs are one of the great success stories of modern medicine and are incredibly effective at preventing the disasters we talked about earlier. The decision to start medication is one you and your doctor make together, based on your numbers, your overall risk, and your other health conditions. There are several different classes of medications, and they all work in different ways. Diuretics, these are often a first choice. They help your kidneys get rid of extra salt and water, which reduces the total amount of blood in your system. ACE inhibitors and ARBs. These are two very common and effective types of drugs. They work by relaxing your blood vessels, which gives the blood more room to flow and takes a load off your heart. Calcium channel blockers. These also help relax and widen blood vessels. Some can also slow your heart rate a bit. Beta blockers. These work by making your heart beat a little slower and with less force, which lowers the pressure in your arteries. Often, one medication isn't enough. You might need a combination to hit your goal. In fact, some of the newest options are single pills that combine 2 or 3 different medications, making treatment much simpler. This is a field with constant innovation. We're seeing exciting new treatments on the horizon, like a potential injection called zilebesiran that may only be needed twice a year, and other new drugs that target hormones involved in blood pressure. The goal is always to find what's most effective and easiest for you. The key takeaway is that treatment must be tailored to you. Your doctor will find the right fit. It's so important that you take your medication exactly as prescribed every single day. Don't stop or change your dose without talking to your doctor, even if your numbers look great. Consistent control is the name of the game. We've covered hypertension and its risks, with solutions in lifestyle and medicine. Now, it's time for you to take charge. Knowledge is key, but action creates change. Start today with simple steps, like using a home blood pressure monitor to get accurate readings. Take 2 or 3 readings a minute apart and share the log with your doctor. The most important step is to team up with your healthcare provider. Work with your doctor to set goals and make a manageable plan. Hypertension is manageable. You have the tools, knowledge, and control to succeed. Share this video, it could save a life.